Well, hello and welcome to the COVID-19 Vaccine Hesitancy Speaker Series presented by Washington Thoracic Society. I am Claire Anderson from Cairo 7 News, and as Cairo 7 cares, we are pleased to sponsor this speaker series. Many Americans are still deciding if they will get the COVID-19 vaccine. The American Lung Association is proud to work with our partners to provide culturally relevant, science-based, factual guides about COVID-19 vaccination. National vaccination initiatives in the U.S. support the critical work of achieving healthy equity for all Americans. Along with our presenting sponsor, the Washington Thoracic Society, we're appreciative of the sponsorship support from pharma and the Fred Hutchinson Cancer Research Center. Few housekeeping items. We will have an opportunity to take questions at the end of the program. Please use the chat feature at the top of the toolbar to submit questions. The call is being recorded and we will send out recording links after all of the speakers series. Today we begin with the series discussion, Vaccine Hesitancy, Laboratory Safety, Production and Distribution, and the Role of Systemic Racism. We are joined by Dr. Stefan Wallace. Dr. Stefan Wallace is an expert in developing, implementing, and evaluating major public health and human service programs in the areas of prevention, care, and treatment of HIV, AIDS, and other infectious diseases. He is the director of external relations of both the HIV Vaccine Trials Network and the COVID-19 Prevention Network. These international clinic trials networks, whose operations are based at Fred Hutch, conduct studies of investigational vaccines and other agents intended to protect people from these diseases. Dr. Wallace leads the network's external relations strategies and efforts globally, with a focus on building long-term relationships with key stakeholders. His strategies create opportunities for consultations with stakeholder communities to inform the design and implementation of the network studies and to optimize the participation of those who bear the greatest burdens of HIV and of COVID-19. An internationally recognized leader and speaker in public health and social justice, Dr. Wallace has more than 2 decades of experience in sexual and public health, social justice, and community mobilization within diverse populations globally. He views public health work through a social justice lens to understand how population-level health is affected by structural and social factors like stigma, racism, sexism, historical trauma, and inequalities in education and income. Dr. Wallace received his MS in 2012 from Colorado Technical University and his PhD in public health epidemiology in 2018 from Walden University. He joined Fred Hutch in 2013. His additional roles include director in the Office of Community Engagement at the University of Washington, Fred Hutch Center for AIDS Research. He is administrative core faculty at the University of Washington, Fred Hutch Center for AIDS Research, and clinical assistant professor in the Department of Global Health at the University of Washington. Also joining us is Courtney Christian. Courtney is a senior director of policy and research at PhRMA, focusing on state-based reforms impacting health insurance, prescription drug coverage, and public health programs, health equity, and leading PhRMA's equity initiative. Prior to joining PhRMA, she worked at the Black Women's Health Imperatives as Director of Policy and Advocacy, and on Capitol Hill for a number of years in a series of roles, accumulating as Legislative Director. Courtney is a Florida State football fan and alum, aspiring chef, and mom to an energetic preschooler. Welcome. Dr. Wallace, can you start us off by explaining how Fred Hutch became involved with the COVID-19 pandemic and how the COVID-19 Prevention Network used the previously established Fred Hutch protocol?
Absolutely. Fred Hutch has a history of science and research. That's literally why the institution was started, was to respond to the prevalence of cancer in communities. And as it's expanded, it's also grown to include other disease areas, including HIV, TB, and malaria, among others. And so the HIV Vaccine Trials Network, which is headquartered at Fred Hutch, has spent the last 2 decades working in clinical trials with communities to find a globally applicable HIV vaccine. And so these experiences, this expertise, and this capacity was leveraged in response to COVID-19, specifically to lead the COVID-19 vaccine trials and the coordination and implementation of those works in partnership with our industry partners as well as government funders.
Thank you. And the unmute button, there we go. Well, thank you, Dr. Wallace. And Courtney, can you explain pharma's role in the response to COVID-19 and the development of vaccines and treatments?
Sure. First, I want to say thank you to the American Lung Association of Washington State, as I'm here in Washington, D.C., for allowing me to participate in this important conversation today with you and Dr. Wallace on such a salient and relevant topic. Pharma, as you all may know, represents over 30 of the leading biopharmaceutical companies that are committed to finding treatments and cures to help patients live longer, healthier, and more productive lives. And in pursuit of that, as an industry, our member companies have invested over $1 trillion in the search for new treatments and cures, including $83 billion in 2019 alone. So a lot of that investment has come to the fore in this unprecedented moment in which we find ourselves in the last year, where our industry really sprang into action as the world looked to us for hope for a vaccine and ultimately a return to whatever our new normal might be. And really the strength and innovation of our industry has really been on display as we've come together for this common cause. Because of our collective commitment to follow the science, we have treatments and vaccines, as you all know, that began to allow for that light at the end of the tunnel of the new normal. And we really applied the same level of meticulousness and diligence with this COVID-19 vaccine that we would have done with any other treatment or cure that we bring to market. And so some of that research and development I talked about really came together in our existing member company research portfolios that allowed us to have faster mapping of this virus and potential ways in which to develop a vaccine. And to date, now we have 2 mRNA vaccines, and it sounds like Dr. Wallace is far more versed than me to talk about the science behind that. And 1 viral vector vaccine that have received an EUA, or emergency use authorization, for administration. So we're making great strides. We have long to go. Our companies continue to work on approaches that both ensure that there's adequate supply and the vaccines fit different patient population needs.
Thank you for the background, Courtney. Dr. Wallace, I spoke earlier about many Americans still deciding if they will receive the COVID-19 vaccine. And last week we heard the Pfizer vaccine has just been approved for kids 12 to 16 years old. Can you comment on some of the vaccine hesitancy concerns and why different communities would have more concerns than others?
Vaccine acceptability is a complicated conversation. I think many communities are experiencing lots of different phenomenon at the same time. We typically talk about this in public health spaces as the social determinants of health. And understanding and recognizing that there are systemic and social and structural factors that influence people's access to healthcare, and not just the provision of healthcare, but also the quality of that care, as well as other basic human needs and rights. Housing is still a major issue in this country. The unarmed killing of Black people is still a major issue in this country, among other social issues. And so for many people, thinking about how trustworthy systems and people are who are seen as actors, who are part of the very same systems that people perceive are not working in their best interest, really complicates conversations about acceptability in vaccines and really medical interventions in general. And then, of course, in addition to the social and structural context, there are also the everyday lived experiences that people have where they face discrimination and oppression and bias when they try to engage medical systems and medical care. Whether that be because their symptoms aren't believed, whether it's because they receive substandard care in general, whether it's because their life circumstances aren't accounted for in the way that care and other services are being provided. In addition to that, there's also the legacy of distrust that is a very real concern for many people. Even people who were not alive during many of the historical examples of abuse in communities regarding research, that legacy is still present in the oral traditions that our communities engage. So people didn't have to be around during the U.S. Public Health Service study of untreated syphilis in Black men to recognize the implications of that particular example in their everyday lives, particularly as people of color, Black and Indigenous people specifically. So all of these, I think, factor into the myriad of reasons why people experience some degree of acceptability. They're sort of situated somewhere on this spectrum of acceptability regarding vaccines and COVID-19 vaccines. And this is not new phenomenon. We've seen it with other vaccines as well. So.
Thank you. Courtney, would you like to add anything else?
Sure. I really agree with a lot of what Dr. Wallace has said. I think in this last year with this, unprecedented pandemic that really kind of compelled all of us to think about the fragility of life, acknowledge it, ours and those of people we love. We also saw this confluence of events where COVID-19 disproportionately impacted people of color. Black people, Latinos, American Indians, Asian Americans represent a disproportionate number of cases, a disproportionate number of deaths. There's a disproportionate number of comorbidities within our communities like hypertension and diabetes. And that really highlighted these sort of longstanding health gaps, health disparities that we've all known about that are exacerbated by other social determinants of health that Dr. Wallace outlined, and also the dearth of sort of meaningful data collection throughout the pandemic. How do we advance that going forward so that we do better? And then in the midst of that, as he also alluded to, we had really serious societal upheaval, all of this loss and then societal upheaval that we saw with the death of George Floyd, the death of Breonna Taylor, and so many others that ignited protests and what I call an imperfect storm, right? One that kind of brought together our collective anxiety in protecting ourselves from this virus. But for people of color, our collective anxiety in protecting ourselves and being able to have and exercise basic Constitution and human rights, the right to life and liberty and the pursuit of happiness, just the same as every other American. And so these events, serve to exacerbate the distrust that runs deeply in so many Black and Brown communities and other communities of color more broadly, so that endures from the inception of our nation. There's a distrust of government, there's a distrust of the healthcare system more broadly, and this reflects the systems of oppression that Dr. Wallace spoke about just now, the historical record, the painful stories that are passed down from generation to generation. I know I have, personal family stories that my mother told me. I see things playing out in my life. I see things playing out in the life and the health of my 5-year-old son. And so these are the types of questions and the types of generational distrust that all of us along the healthcare spectrum really have to work together to try to dismantle, answer those hard questions with truth and transparency. And I think that's a way in which we can get around some of these vaccine hesitancy concerns.
Thank you. And Dr. Wallace, Cairo has reported on the discrepancies in BIPOC communities with diagnosis, treatment, and morbidity. In your opinion, what are the reasons for these discrepancies?
Sure. Well, I've talked pretty well about much of this already, but I will say the adage that's often spoken is that if America gets a cold, then Black people get the flu. And this is true whether we're talking about COVID-19, HIV, cancer, hypertension. it doesn't matter. And the reality is that this is really not about there being genetic differences that make Black people or BIPOC people more susceptible. It is really these social determinants that are impacting our ability to live better lives, to live well. Environmental pollution, neighborhood stability, air quality. I can go down the list of, we're still talking about water in Flint, Michigan. And I think that the piece to sort of wrap up and respond to your question more succinctly is that these issues, when you overlay them with the chronic health conditions that exist in our communities that are really exacerbated by these conditions, that these underlying health conditions and the structural factors that ensure that BIPOC people are overrepresented in essential workforce positions where they're likely not able to get time off from work, sick time, childcare, and lots of other considerations that would provide a barrier or a buffer in terms of their susceptibility and risk of coming in contact with this virus. That these things are not in place, that these barriers, these buffers, are not established and in place for our community. So as a result of all of these things, we talk about syndemics, and Courtney talked about the perfect storm, that all of these things really work in harmony to create the disproportionate impact that we see in BIPOC communities as it relates to COVID-19 cases, hospitalizations, and deaths.
Thank you. Courtney, we heard some of the reasons for community hesitancy and concern about vaccine safety. Can you walk us through how the vaccines were developed and how we were able to get shots in arms at this unprecedented rate?
Sure. I think that it's been a yeoman effort, on part of a lot of different players within the healthcare system to get to where we are now with over 1 billion people vaccinated globally against COVID-19. So that's quite an achievement and quite a relatively short amount of time, right? Again, I would say that our vaccines were developed within, in concert with government and among our member companies from some of the existing research portfolio that we already had. So again, that allowed for greater sequencing, faster sequencing of the genome, of the COVID-19 genome, and the makeup of the virus, and potential ways that we could develop this vaccine. This again was really brought together those decades of partnership and chronic disease expertise and responding to other viruses like this across our member companies with our R&D expertise to really have all hands on deck, all researchers on deck through every phase of the clinical trial process. And so to date, again, 1 billion folks have had the shot. We've been able to get people to really see that we followed the science. This is the greatest path forward to getting back to whatever life was before March 2020. I don't know about you, but sometimes I can't really remember what was happening then. But whatever that new normal looks like, so that we can kind of bring this global health crisis to heal and have a more normal life. I will say that our work continues in terms of development of other vaccines. We've got about 1,800 clinical trials underway. So this innovation's been going since the very first sequencing of the vaccine. And some of these trials are being conducted in multiple countries. There are about 405 being conducted in the United States right now. That requires significant investment. That requires us overcoming these vaccine hesitancy fears so that we can get people in communities of color to participate in the trial, so that we can make sure that the vaccines that we produce are have efficacy, greater efficacy for everyone, so that we can continue to make sure that we are ensuring the health and safety of every person that takes this vaccine or any one of the vaccines.
And more people from underrepresented communities were part of the clinical trials for COVID-19. How do we work toward greater representation across all clinical trials?
Yeah, I'm glad. Thank you for that question. You know, most clinical trials, every company, every one of our companies, you know, strives for greater clinical trial representation. The FDA clinical trial drug snapshots don't always paint the best picture and clearly show that there's a lot of work to be done there. And I think the search for the vaccine has really sparked consumers and patients to think about, what is the clinical trial process? How can I be involved? How can I do more and learn more about it? And so one thing that we've done in the last year or so, as we've really been working on this, is to release first ever industry-wide principles on clinical trial diversity. And what we're doing is including expanding on that conversation about trust that Dr. Wallace and I were talking about in communities of color, BIPOC communities. What does that mean? So 4 main areas that we're focusing on are building that trust, acknowledging past wrongs, right? Acknowledging all the reasons for medical mistrust in communities of color, reducing barriers to clinical trials. So where are our sites located? Are they accessible? Using real world data to enhance our information collection and gathering on diverse populations beyond product approval, and then also enhancing information just more broadly about diversity in clinical trial, really doing real education and outreach efforts so that folks understand this is not an experiment. I think a lot of people have that hesitation, and it's probably a little bit contributing to why people are not, some people are not choosing to get vaccinated. But we really have to, again, dismantle those barriers and have frank conversations about it. And this is one way in which our industry is approaching that.
Thank you. Dr. Wallace, can you describe your prior efforts in building community partnership with a public health campaign and what you think is necessary to accomplish our COVID-19 vaccine goals?
Sure. All of our prior efforts to engage communities have started with the singular truth, and that is research cannot move forward without communities being involved. And whether that always plays out well in the research enterprise or not, for the HIV Vaccine Trials Network, we have committed ourselves to doing the meaningful work and engagement to ensure that communities are centered and engaged and involved from protocol design to implementation and evaluation. And so in that way, communities are at the heart and the center of our work. And this has been the case since the network first launched in 2000, and it will continue to be the case. My work personally is aligned in this way, which is why I am a part of this institution, because our missions and our ethos are aligned. In terms of how we think about moving forward in this way, and I think this sort of dovetails back to the prior question about diversity, I think it's really important that we work collectively to not just address how we meaningfully engage communities through efforts in the clinical trial space, in the public health space around health literacy and science literacy, but also that we are intentional about dismantling systems and policies and processes that perpetuate these systemic racism and other experiences that further divide and create harm in communities, intentional or not. And one of the ways in which I think that can happen is by intentionally ensuring that communities that are most impacted are overrepresented in clinical trials, and not just by their population size, which I do think is an important marker considering the history and legacy of research in this country. But I would argue for infectious diseases such as SARS-CoV-2 and even HIV, that we really push to oversample communities that are burdened by these conditions, by the disproportionate burden that they're experiencing as a community. So we go past their population representation percentage and look at the percentage in which they're being affected by these diseases.
And Dr. Wallace, as a community, what can we do to support the public health campaign to end COVID-19?
I think that we all have a responsibility to address the truth and the reality. I think misinformation and disinformation has a space to continue to live and permeate our communities, our society, and not just be weaponized as it's been here recently. There have been plenty of examples of that, but also the ways in which it moves in stealth through our dinner tables, through our private conversations. When we hear information and we know it not to be true, it's incumbent upon us to speak to that. It's incumbent upon us to address that. And where we do not have accurate information or appropriate information, I think it's important for us to seek it. So as a collective, as a group, how do we do this? We educate and arm ourselves with accurate information. Go to trusted sources for this accurate information. And as Courtney has mentioned, follow the science. Science does not care about our personal opinions. Science is looking at the data. Science is not, concerned about, what we think and how we feel. It's like, what can we prove? What can we really show? And I think that it's really important that we consider how to not just better integrate that into our vernacular and our conversations, but also to ensure that we're meaningfully engaging communities. And that we're utilizing trusted voices within communities and building capacity within communities to do this work themselves. That we don't take colonial approaches with community engagement and think that I'm such and such at such and such institution, so because I have the funding, I need to do this important work. Well, no, it's probably good if community people are doing this work. Particularly community people that reflect the people that you're trying to engage. And so I think that the level of nuance in answering this question could actually take us well over the time frame for this session. But in summary, I will say that there's a lot of work to do. We all have a role in place and a space to do this work, and it's important that we do it.
Thank you. We now have some time to answer any questions that have been populated into the question and answer. So,
I'm sorry to interrupt, but if I could kind of follow up just a little bit on what Dr. Wallace was saying. I was on a panel last week with a similar conversation, and someone asked what was the one takeaway that I would want someone to take away at the end of the conversation. And it's almost probably word for word what Dr. Wallace just said. And that is that I would encourage people to fully educate themselves, not just listen to sound bites, but really deep dive into the information, follow the science, listen to the experts, trust, and I know that could be difficult, but trust that we are all kind of working together and leveraging the different parts of the healthcare system to ensure that everyone is being treated equitably, fairly, has equitable access to the vaccine. And on the downside, post COVID-19, how are we going to fix some of the issues that we saw really probably get even more entrenched, longstanding health disparities get even more entrenched? What are the solutions that we're going to be for on the other end of on the other side of this, and how are we all going to work together for it? But very particular in the communities of color, again, we want to cut across any misinformation that is out there, and we really encourage people to educate, read, and then be trusted messengers within your families, within your communities. And don't be afraid to share the information that that is factual, with other people who are maybe having a conversation a little on the fence. I don't know, should I, shouldn't I? Make sure that they're trusted partners within the community, and maybe you're the trusted partner within your own, trusted person within your own family, that doesn't give out information, but gives out information that is useful.
Thank you. All right, well, we do have, thank you again for that response. Now, we do have some questions.
As a reminder, you can put your chat your questions in the Q&A box, but we do have several to go through. The first question is, if I have a choice, is one vaccine better to get than the other? Dr. Wallace, can you start us off?
Generally, I would say no. They all basically do the same thing in terms of how they work to create an immune response that supports protecting us from disease. The caveat being that if you are a person who is concerned about serious blood clots, that may impact your decision to get the J&J vaccine. And if you are a person with a history of severe allergies, then you might, take that into consideration regarding the mRNA vaccines. But there are clinical and medical guidelines to support how people can get either of the vaccines safely with these conditions. So.
Thank you, Dr. Wallace. Courtney, did you have a response?
Yeah, I would say, whichever one that you have access to, but also that is preferred in consultation with your doctor, right? Your doctor, and you know best your medical history, and it probably can shepherd you towards which other vaccine, but they all, ultimately work to do the same thing, which is to neutralize the virus and lessen disease progression and harm.
Thanks, Courtney. Courtney, you identified representation in clinical trials. Can you identify who was included in the trials?
Sure. All of our companies really, because we recognized what this vaccine was going to be and what it was going to need to be on a global scale, many of our companies went above and beyond sort of usual clinical trial protocol to really think outside the box and think about how we can widen the representation among communities of color in the various clinical trials that were underway and that are still underway. And so quite a few of them, Pfizer in particular, had nearly over a majority of their clinical trial participants who were people of color. And so that really allowed some of the other players in the space to really think about and push them towards making sure that there was adequate representation within their trials as well. And so we were able to see on the other side of that now that we had good information and good data about the efficacy rate in people of color that has been able to inform some of our vaccine efforts on the backside.
Thank you. Dr. Wallace, you talked about overrepresentation on BIPOC communities in clinical trials. How would someone in that community who is interested participate?
Sure. If you go to the preventcovid.org website, you can input your information into the registry to be used in the clinical trial sites who are going to be conducting. I think it's the next trial is the Sanofi trial. We'll be able to reach out to you and engage you in that way. Fortunately / unfortunately, depending on your perspective, the other phase 3 trials that we're coordinating have completed enrollment. But another source to consider looking at for information about upcoming trials, earlier phase trials that Courtney referenced, is a website called clinicaltrials.gov. And there you can see all of the various trials that are happening in your country and other countries regarding COVID-19 or any other disease outcome.
Thank you. One question that came in is, what are your thoughts about the country's ability to get a COVID vaccine in arms in less than a year, while getting a vaccine for HIV hasn't happened, even though it's been in development for decades. Dr. Wallace, would you like to start this?
Sure. This is a space that I occupy quite a bit. HIV is a very important health condition. It's a priority for us as a network. We've been in this space for some time, and honestly, the differences between the viruses are distinct and important, and I think noteworthy, including that HIV, aside from it being a retrovirus, it has characteristics that make it much more complicated to find the weakness. We were able to identify the weakness in the SARS-CoV-2 virus early on, in part because of our previous efforts and research on other coronaviruses, including SARS and MERS. I will also add that part of what we've accomplished in the COVID-19 space is also due in part to our experiences and work in the HIV space, and leveraging, again, that expertise, that knowledge, those perspectives, and more specifically, the capacity, the clinical trials capacity, the statistical capacity, the laboratory capacity, allowed us to do this, in addition to the large, massive amount of coordination of these trials and efforts that have occurred, not just here in this country, but globally. And then I think the biggest sort of trigger to this is funding, honestly. The amount of public dollars that went into supporting COVID-19 research is near unprecedented. And there are many people in the community who are looking forward to seeing how we take lessons learned, including funding from COVID-19, and apply it to HIV going forward. And I can tell you that that work has already started happening. As an example, we've already started leveraging the mRNA technology in HIV vaccine research in earlier phase studies. So I'm hoping that we will absolutely see an end to not just COVID-19, but HIV at some point in the future.
Thank you, Dr. Wallace. Courtney, did you have a response to this question?
I do not. I'm going to let the expert speak. Let his words stand.
Thank you. Another question that is in the chat box is, what are the side effects of the vaccine, and when will I know if I have the side effect? Courtney, would you like to start?
Sure. I think some of the side effects of the vaccines are probably well known: fever, arm soreness, you know, a little nausea. I can say myself, as fully vaccinated, I had a couple of those side effects myself. But I think, you know, at any point in which you feel that you feel overcome by those, you should certainly, you know, go to the doctor, call your physician, and, you know, be evaluated just to be on the safe side. But those are some of the more well-known side effects. There are, to Dr. Wallace's points, you know, some evidence of blood clots in certain vaccines, a very small sort of percentage. But at any point when you feel sort of overcome, I think, by you know, feelings of just feeling unwell after your vaccine, please go to the doctor. Don't try to self-diagnose, as some of us do. We go on WebMD and try to figure it out. Don't self-diagnose. Please go to your physician.
Thank you. Dr. Wallace, do you have anything to add?
Yeah, just to say that side effects and reactions are being tracked even for people who are vaccinated in the emergency use authorization space. Here in this country, we use a program called BeSafe, as well as VEERS, where this information is being collected. So we're continuing to look and track this information, and it's really important. So people who experience these things, you know, please do make sure that you report them, and also speak with a provider from your vaccination center or your own primary care physician if you have one.
Thank you. Courtney referenced any last words or key takeaways for the participants as they go back into their community. Dr. Wallace, would you like to start?
Actually, I will defer to Courtney to start.
Okay, Courtney may start.
Ladies first. Sure. Again, I would encourage listeners to educate themselves, as I said, find all the relevant and salient information you need to share. Think of places like Pharma as a resource. We have a website dedicated to coronavirus information and facts and how our industry has responded to the moment. It's pharma.org /coronavirus. We also are taking this work seriously as we pull some of these pieces through and think about how pharma engages as better corporate sponsors and think about equity and health equity. And so we've launched an equity initiative. There's more information about our work around clinical trial diversity there. It's pharma.org /equity. And I think that there's a lot of salient information there about clinical trial diversity, what it means, how we are planning to work towards it, but also a lot of good information that are starter conversations and starter pieces for conversations within communities and within homes, where people can kind of really have the conversations that they need to have to, again, educate themselves, cut through the misinformation, encourage people to get vaccinated, and then encourage people to be curious about the process post COVID-19. How do we work together to solve some of the healthcare disparities that were really highlighted and run aground here within this pandemic? And how do we find solutions on the other side?
And Dr. Wallace?
Thank you. As I mentioned before, we all have a part to play in this process, and I think it's critically important that we take up information that comes from trusted sources, and that we work hard to be trusted sources of information in our communities as well. I also think that it's really important that we continue to do the work of interrupting misinformation and disinformation as we encounter it. It's real easy, I think, to click like and to click share on themes and messages and videos that support perspectives that we might have about, the industries and other groups, researchers, the medical field, and many of these things, though they may be rooted in some degree of truth, are actually harmful in our communities because they create a further gap and divide from people being able to actually access accurate information. The other thing that I will say is that there are many types of communities that are engaged in education efforts around this. That includes faith-based organizations, in addition to medical institutions. And so I would encourage people to also check out our website, preventcovid.org, to learn also about the amazing faith initiative work that we've been doing to build partnerships and relationships with diverse faith communities around the country. And finally, I will say that I recognize that we are making quite a bit of progress in this area, and there may be a desire for people to sort of fling the door open and sprint to get to some degree of normality. But I would encourage people to continue to follow the science with respect to how they navigate this for themselves and for their families.
Thank you, Courtney and Dr. Wallace. Since we have the time, we have one more question. So post your last thought. The last question will be, there is a fear that the vaccine may have a long-term impact on humans' ability to deal with disease in the future. What are your thoughts on vaccine dependency? Dr. Wallace?
Yeah, we actually do not see long-term impacts for vaccines in general. And I think this is especially important for the work we're doing with COVID-19, because the mRNA vaccines and vaccines in general really don't stay in your body very long. Like the point or the goal of a vaccine is to teach your body to better recognize and fight invaders. And after they prime our immune systems and basically get our immune systems ready to do this work, they degrade. And so after that, then your immune system is sort of primed and ready. So we don't really see long-term impacts. I understand the concern around that. And typically I would say that, that's a concern for other kinds of medications, but not necessarily for vaccines.
Thank you, Dr. Wallace. Courtney, did you have anything further?
No. All right. Mute, unmute. No, thank you.
Thank you. That's all of the questions, Claire. I'll hand it back to you.
Well, thank you for your contributions, Dr. Wallace and Courtney. The Lung Association, the American Lung Association, is pleased to share our Better For It Vaccine Toolkit series. The series now has 4 toolkits available for Black American, Latino, Indigenous, and general population communities. The toolkits are designed to help to reduce the morbidity and mortality of disease by offering trusted resources on the benefits and importance of immunizations, particularly in communities disproportionately affected COVID-19. Each of the culturally relevant toolkits provides the opportunity for individuals and communities to fact check and supplement their own research on vaccines, especially the COVID-19 vaccine, encourage a dialogue among friends, healthcare provider, pastor, and family members, share accurate information on social media, learn and understand the contributions of scientists and public health advocates who are helping to bring this pandemic to an end. The Lung Association is asking you to provide this information with your networks as appropriate. These toolkits can be found and downloaded at lung.org/vaccine-toolkit. This speaker series will continue next week and 2 consecutive weeks, specifically illustrating the unique concerns in the Black American, Latino, and Native American, Pacific Islander, and Alaska Native. We would love to have you join these episodes and share the American Lung Association toolkits with your community and networks. If you would like to join the other weeks of the speaker series, use the original RSVP link to be sent the calendar invite. Thank you for joining us today, and thank you to Dr. Wallace and Courtney for sharing your expertise.
Thank you.
Thank you indeed. Appreciate the invitation.